Listen to the vibes.
The views and opinions of our guests may not necessarily reflect those of the host or the Vibes Broadcast Network. Listener discretion is advised.
Welcome, everyone, to another episode of Listen to the Vibes. And I am very privileged to have Miss TERRI, is it Bacow?
Bacow.
Nice, I got it right. Okay, so if y'all might notice, she is a little hard of hearing. So we're going to try to take it a little slow. So maybe she can understand me. I already have a hard time speaking English, so I feel bad for her. But we're going to get to know her, and we're hopefully going to learn a little bit about anxiety and how to deal with it. And also, she has a book. So we're going to let her talk about her book as well. It's called Goodbye Anxiety. And I will be leaving the links in the description so everyone can click on it and go straight to it. So let's kick this off. TERRI, tell us a little bit about yourself.
Sure. So I am a licensed clinical psychologist. I have a private practice at the Upper West Side of New York City. And I see clients in my practice about 4 days a week. And in addition, I'm an author. I wrote this book, Goodbye Anxiety, as you mentioned, a guided journal for overcoming worry. And it's based on my over 20 years of experience providing evidence-based treatment for anxiety disorders, including worry. The book focuses mostly on worry, and I think the pandemic brought out so many mental health concerns. And in fact, I started writing the book during the pandemic, actually while distance learning to kids. So there were plenty of inspiration from writing this book. Let's see what else I can tell you. I live with my husband and 2 kids, and I really enjoy binge watching TV, like the rest of us, and exchanging memes when I'm not working.
And when you talk about anxiety, do you also talk about PTSD?
Yes, of course. Not so much in this book, but I am, of course, familiar with it.
Okay. Well, I had spent some time in a hospital. I had a breakdown. I deal with depression, anxiety, and PTSD. Was molested as a child, and all those feelings kind of came to surface. I guess it's been, 10 years or so ago. And so I finally got all my diagnosis, and they put me on a lot of medications. I will say the medications didn't help. In fact, some of them actually made things worse. So I got into meditation. Do you teach about meditation?
Sort of. I teach mindfulness, which is a type of meditation.
Okay.
Mindfulness is a skill where you really focus on the present moment and you kind of ground yourself. So it's similar. But I'm really sorry to hear that happened to you. And it makes sense to me that maybe meditation wouldn't work for that.
Well, it's been difficult because sometimes the medications make me feel like I want to hurt myself. And so I must stress this to everyone out there. You consult your doctor before you do anything. I'm going to tell you what worked for me. That doesn't mean it's going to work for you. I did wean myself off the medication, and it took me a while because you have to gradually get off of it. It's not something you just quit overnight. Anybody that's gone through withdrawals, they're not pretty. They make you feel like you have the worst case of the flu and just misery. And so that's why I took my time to get off of it. I spend a lot of time meditating when I'm getting into a situation that causes stress, like, getting on a crowded bus or an airplane, or, going to a concert, going to look at fireworks. I mean, all these things are triggers for me. And so I have to spend time convincing myself everything's going to be okay. I know when I get into a building, the first thing I do is make sure I know where all the exits are in case I need to leave. I'm fortunate that my wife is there with me, and I can look to her and she knows how to talk me down and calm me down. But I'll say it's been a lot easier over the last few months getting used to, just doing the meditation and getting away from it. It doesn't always work for everyone. Some people need the medications. I'm not sure if you're able to prescribe those things, but I mean, you deal with that kind of stuff. What is your feelings on it?
Sure. So first of all, I think everyone needs to do what works for them.
Mhm.
There's no one size fits all approach.
Exactly.
Everybody's different. So you have found a coping strategy that works really well for you, which is fantastic. In terms of my feelings on psychiatric medication, I think that they are great when it works, because when you think of mental disorders, a lot of them are biological or neurobiological. There's like a neurochemical component, like a serotonin shortage or a problem with dopamine. And in those cases, of course, you could take psychiatric medication, just as you might take it for heart disease or cancer. And I think the stigma of it needs to really go away.
Yeah.
And other research shows that the best treatment is typically a combination of therapy and medication. So I think that it works best when they can be combined.
Definitely. I went to therapy quite a bit for a long time, and I don't really get to therapy anymore. I probably would benefit if I did, but I have a lot of health problems, and so I don't get out in public as much as I used to. I wonder if some of the medications that I take might have an effect with the medications that were supposed to be for my anxiety and depression. So, I mean, I'm diabetic. I have high blood pressure. And then I have a disease in my spine where my spine deteriorates. So the bone breaks down, the discs in between break down. And so, pain medications, all these things, the medications that I don't like taking opioids because I have a very addictive personality, and I wanted to get off of that kind of stuff. And so they give me a medication that is labeled for, it's a form of methadone to get you off of opioids, but it's off label. They use it for pain and it works incredibly for me, but I do notice it does offset other types of medication. How do you deal with people that have all these things wrong with them?
That's a great question. I think it depends on what the presenting problem is. So in my practice, I don't really see high risk cases or people that are suicidal or who are in crisis. I tend to see what we call higher functioning kind of conditions like anxiety or just depression or maybe relationship issues, self-esteem. I think because my family life is so busy, I am not in a position right now to work with complex cases.
Gotcha. Well, with the pandemic and everything and people being locked down, you have people that are on their own, and to be separated from society for as long as we were, gosh, you had to have gotten a lot of phone calls about people that were dealing with depression.
Certainly, I mean, the pandemic was a whole other plane of reality. And I was sort of learning how to do Zoom therapy at the same time that all of my clients were really figuring out. So it was a really intense period. Like if you think about March of 2020 to about maybe July of 2020, it was insane. And I remember I had never done therapy by Zoom before. And so I remember I was in sort of the guest room of my house and I didn't have a desk. So I took a seat pot and turned that upside down so I could put the iPad on it. And then we ordered a desk. But it was just like outrageous, and everyone was really stressed out, and I myself was really stressed out. So that was interesting. But
To
yes,
say the
I think,
least.
yeah, yeah, yeah. But isolation really is a problem. And I think what's interesting for me is that my clients either range from really bored, they were lonely and bored, or they were not lonely and bored. The families were on top of them, and they couldn't get a minute. They were overwhelmed.
I can see that. Gosh, well, being a therapist, and I'm sure a lot of other therapists, y'all had to kind of learn something new because nobody really dealt with this. Yeah.
I feel like I'm always learning. I think I know everything, and then I discover something. It's really rewarding.
So what methods do you use to help people that are dealing with anxiety?
Absolutely. So I am best known for a particular therapy approach called CBT. It's alphabet soup. Are these letters and acronyms? The CBT stands for Cognitive Behavioral Therapy, which is an approach that is present focused, action oriented, solution focused. It's a little less attention is given to the past and more on what's happening in this moment and what can you do about it. And it has a kind of a didactic component in the sense we're teaching skills, we're teaching strategy, actionable strategy, like breathing, or mindfulness, or reframing your thoughts, or problem solving. Those are some strategies that we use in CBT. And CBT is considered one of what we call evidence-based treatment, meaning that there's research supporting this therapy approach as being effective. And I really feel proud of that. And I also do similar kinds of therapy that have letters in them. ACT, DBT, those stand for similar kinds of skill-based therapies where we're really focused on teaching clients skills.
Do you use methods like tapping?
I don't believe so.
Okay. Because I know some people, they swear by it. I personally have not really gotten into it. I really should. Some people will use like a rubber band or something, and some people do these pressure point taps. What methods would be involved with what you do?
Sure. So, for example, we might talk about how your thoughts, if you're feeling anxious, what are the worried thoughts you're having? And that might sound like a really simple question, but it's really the foundation of everything. I encourage clients to, what specifically are you worried about? What is your particular concern? What's the story you're telling yourself about this situation? Once we identify the thought, we can then take a step back and examine it and really look at it critically. Do we have any evidence for that thought? Do we know 100% that what you're worried about is going to happen? And this is really effective for anxiety because with anxious people, there tends to be a lot of overreaction. Sometimes stress is legitimate and warranted, but when you have anxiety, typically you're kind of overreacting a bit, you're kind of catastrophizing. And so what CBT does first is it really helps you take an eagle-eye view of your thoughts and to challenge them using Socratic methods, meaning kind of being like a lawyer, asking tough questions about your worry.
Okay. Yeah, that makes sense. Are you familiar with past life regression when it comes to hypnotherapy?
I don't think so. I think it's great to have different approaches and to integrate them. I'm not quite as familiar with that one.
Well, there's something similar that they do where you go over scenarios in your mind that has happened to you, but you kind of tell the story in a different way each time you tell the story. And I know, like you said, sometimes you go overboard, you think the worst is going to happen. And then when you reason out and really say, well, you know what, that's kind of silly in a way. I'm trying to think of a scenario in my head, but like going into a crowd, sometimes you think, oh, I'm going to be stuck and I'm not going to get out and something bad's going to happen. But statistically saying,
Yes,
these
yes.
things don't happen.
Yeah, the way that I relate to that, the way that I interpret that is what we would call marginal exposure.
Mhm.
This is something we do in CBT. And when you mention PTSD, that's where my mind goes. Because people with post-traumatic stress are really afraid of what happened to them. So they avoid thinking about it. And they avoid situations where that thing may happen again. So one of the things we do with PTSD treatment is in vivo and marginal exposure to the thoughts and the feelings, and to kind of encourage clients to actually imagine the worst case scenario happening and then how they would deal with that. And the reason we do that is to experience habituation, to get used to the images so that you're no longer afraid of them.
So let's say we'll take the example of being in a crowd. Okay, I get anxiety and I feel like I'm going to be trapped and something bad's going to happen, like a fire or something, and I can't get out, or somebody's going to trample on top of me, that kind of thing. Walk me through it.
Sure. So you have to kind of think about probability versus possibility. Just because something is possible doesn't mean it's probable or likely. So I always encourage clients to examine the realistic probability of this bad thing happening. Sure, it could happen, but it doesn't mean it's going to. So maybe in the moment you feel this is 100% likely to happen. I'm going to get trapped in this fire house or scenario. But what do we know? What's common sense? What are the facts? And the facts are, this is really unlikely. Now, if the person had it happen to them before, what I would say is, it happened one time, it doesn't mean it's going to happen again. The past doesn't predict the future. So this happened to you, it was really hard, but we still don't have any evidence that it's going to reoccur.
Because I've been in concerts where I'll get kind of crushed in and I can't seem to get away, and I'm being pushed around and led different directions I don't want to go, and I want to get past that feeling. So I can tell that story, but then I can say, well, it did happen once, it probably won't happen again.
But part of that is, if it does happen, this is the next chapter. How would you cope? So I'll have a conversation with the client about the low likelihood. Okay, but yes, let's say it does happen. You're in a crowded place, you got pushed and shoved around. Let's make a plan for how you're going to cope with that. Because avoidance and anxiety are best friends. The more you avoid, the more anxious you become. So the best thing is to really put yourself in the anxiety-provoking situation over and over again and really habituate and get used to it. But it doesn't mean you have to do that without any help. So I might say, could you do some breathing in that moment? Could you do 5, 4, 3, 2, 1, like a grounding exercise? Could you have a support person with you, to really brainstorm coping strategies?
Do you ever run across people who just can't seem to make that happen in their mind?
Of course. I mean, some clients really double down with the avoidance. And there's not much you can do. I mean, that's not true. If someone's really committed to avoidance, then I would say, I can't help you. You have to be motivated. You have to be willing to tolerate discomfort in order for me to help you.
Yeah, that's got to be hard for some people. I know it took me a while before I was able to cope and actually, get the help and accept the help and to, change that situation in my mind. But I know there's got to be some people out there, it's very, very difficult for them. We want to see everyone get help.
Yes. And so one thing that we can try sometimes is something called motivational interviewing, which is when someone's ambivalent about change, to kind of work without resistance and to try to enhance motivation. Another thing is if someone's really afraid to enter a situation, we always recommend incremental baby steps, graded exposure. Like, okay, you're not willing to go to a rock concert, that's understandable, but could you go to the supermarket?
Yeah, that sounds good. I'm trying to think of another situation because I know there's somebody else out there they need some kind of help, and that may be a different scenario for them. Maybe it's not so much crowds, maybe it's just people in general, because especially you think of women who have been assaulted.
Right. Well, rape, I believe, is a better fit for a PTSD treatment, trauma treatment. But that involves a cognitive component as well, not just a behavioral one. So the behavioral component would be, are you avoiding going out at night? Are you avoiding going on dates? Then maybe can you gradually put yourself back in the situation? But before that, we need to really talk about something called schemas. Or what the schema is sort of your core beliefs. For example, people can't be trusted. You kind of have to work with the belief and the core beliefs that happen after a traumatic event. And really identify what those beliefs are about safety and help people reframe before they can do exposure work.
Well, I could say it's a little bit easier now that I'm older, but when I was a kid, it was kind of hard to trust people. And I say men go through that too. They've got to, I guess men probably a little more embarrassed to talk about it. Yeah.
Well, what I'm thinking about now is social anxiety unrelated to trauma. A lot of my clients have social phobia. Fear of negative evaluation and being embarrassed, public speaking, meeting people, all of that.
So what kind of percentage would you say of the people that you talk to have a tendency to want to harm themselves?
I would say relatively few, just because of the nature of my practice. But it does come up from time to time, obviously. And in those instances, I will make a safety plan with them. I might have to send them to the emergency room. If they have a psychiatrist, I would enlist the psychiatrist and work together. Maybe the person will need to go to a higher level of care, such as an inpatient hospital.
Yeah, that's what I needed. I heard voices. It got so bad. I guess you don't deal with that extreme of a patient, though. I feel for people because sometimes it's just hard to talk about it. Whatever situation you've been through, you're embarrassed or you feel like you deserved it, or I mean, there's all kinds of reasons why people find it hard to get the help they need. And I want encouraging words for someone out there that's watching this or listening to this. So what advice would you give?
Sure. So depression is tough. It's really tough. And I think one of the hardest things about depression is some of the existential things that come up, about having meaning and purpose, like what's the point? And I think one of the things that defines depression is hopelessness, feeling absolutely hopeless, feeling pessimistic that it's going to get better. And so you have to find a way to work with the person on meaning making, finding purpose in life, bringing back pleasure and enjoyment, and kind of finding hope. If you think of the word hope as an acronym that I like to use, which is hold on, pain ends. And my clients don't always believe me that it's going to get better. But I always say you don't have to believe me. You just have to entertain the possibility that it might be true.
Yeah, sometimes it is difficult.
Of course.
Once again, I mean, I sympathize with people because there were times in my life I never thought things were going to get better. Especially when you live alone. I spent years by myself, and although I needed some of that time to kind of get to know myself again, I'd been in a bad relationship, and it seemed like one bad relationship after another, and it got to the point where I just felt like things were never going to get better, never. And I look back now and I can kind of chuckle about it a little bit because things did get better, but they're, trying to convince some people, I don't know how you do it.
Well, I tried, but first of all, I'm so sorry. That sounds like really rough. You've had a rough period, and you couldn't read the future, so you didn't know. But what's coming to mind now is focusing on making a distinction between what you can and cannot control. I think that's a really important distinction to make, because a lot of times we dwell on all the things we can't control, and we don't always focus on what we can.
Mhm.
So this is maybe where a little glimmer of hope can come about, which is problem solving. What can you control? What can be done? You just had this breakup. It's awful. I wouldn't wish a breakup on anyone.
Yeah.
It's the worst. But kind of one day at a time, what can you do? That could be empowering.
Yeah, especially when you've been married for 17 years and someone leaves you for somebody else.
I mean, I think divorce could be debilitating because someone's identity is wrapped up in the relationship.
Yeah. And I think if people would look at it in a positive way, it ended up being the best thing that ever happened to me. I had totally lost myself. I didn't know who I was or the things that I liked anymore. And that first initial time by myself, I started to remember, oh yeah, I like doing that. And I would go do the things that I enjoyed, and trying to find somebody else who can encourage you or share those things with you. It sometimes it takes a while, but I was fortunate. I found somebody who enjoys a lot of things I do and has introduced me to things that I didn't know that I would like. And I hope that people realize there's other folks out there that can be a part of your life and help you and to do those things. But sometimes you need some time alone, and you need to talk to someone.
Yeah, yes. And I think it's really common after a breakup to be absolutely convinced that you were never going to meet anyone again.
Yeah.
I have been there. I have. And it's really the worst. And I think, like he said, when we're so busy staring at the door that's closed, we can't see the doors that are going to open. And the other piece of this is that when you're depressed, nothing is fun. It's all really hard. So you have to do incrementally things that bring you positive reinforcement, even if it's really small. So I always say, cleaning your bathroom is activating. Going to buy toilet paper is activating. Behavioral activation is when you try to have a mastery experience, a sense of accomplishment, and that can really help with depression.
Oh yeah. That's why I say start your day off making the bed, and you can say, hey, I've accomplished something already this morning. That's why they make you do that in the military, so you feel that sense of accomplishment each day. Another problem that's come up in my life, and I know there's somebody else out there dealing with the same thing, is you've been relatively healthy your whole life, and all of a sudden something like the disease that I have, I had to quit working, and it can be debilitating at times. The pain you deal with, and then also that feeling of being a burden on others. Do you deal with people like that too?
People who are burnt out?
They feel like they're a burden.
A burden, yes, forgive me. Of course. I mean, I think that guilt is a universal emotion that is overly used, overly occurring, in the sense that we all feel guilty so much of the time when the guilt isn't warranted. You know, if you look up guilt in the dictionary, it's person who committed a crime, person who did something wrong. And when you really examine the situation objectively, there's nothing to feel guilty for. It's not a burden. People love you. They want to help you. They're there for you. That's the nature of reciprocal relationships. So I think a lot of reframing has to be done for those folks.
It's difficult, because like when we go out and there's a lot of walking involved, well, most of the time I have to have a wheelchair, and I feel like I'm dragging everybody behind, and keeping them from enjoying themselves because I need help getting, I don't know, say like let's say like we go to the lake and you have to kind of go down a slope or get around rocks, and somebody has to help you to get there. That it's frustrating because I feel like I'm taking away from their time, even though deep down I know they love me and they want to do that for me. You still can't help feel that guilt.
So, I mean, I think your feelings are valid. Our feelings are valid, and that makes a lot of sense. And what's coming to mind now is the concept of radical acceptance. Are you familiar with that?
No.
Sure. So radical acceptance is sort of an empowering strategy where you make a choice to really accept reality for what it is. Because rejecting reality doesn't change reality. So there's many circumstances that we hate and we despise and we don't like it. But when you put all your energy into despising that thing or wishing it would be different, you take away from your life. So radical acceptance is the opposite. It's kind of getting rid of the suffering that comes from rejecting reality to free up your mental space to think about other things.
Yeah. Well, sometimes we let pride get in the way. You don't want to be people to do stuff for you. You want to be able to do it for yourself, even though deep down you can't. And it's a hard thing to deal with. But yeah, I guess the thing is, I would do the same thing. Say if my wife was in this situation, I would want to help her, and I wouldn't want her to feel guilty. But I just can't help it.
And I don't talk about it that often, but the reason that I have a hearing impairment is that I had meningitis when I was 3.
Oh man.
And it's really unfortunate. It's really difficult for a long time, and I wish that hadn't happened. But I really had to make the best of it. And I think it's funny that my job is talking. I had to listen all day, every day. But I think it's important to do what I love. And I think that it's important to accept reality, and try to make the best of it.
This ended up being a blessing for me too, because I took the podcasting more serious, and now I get to do it every day, and I get to meet wonderful people, and I get so much help from a lot of the people that's on my show. And so I look at it as, like I said before, it's a blessing that I don't have to worry about going to a job. This is my job, but it's not a job.
And you were great at it.
Oh, thank you. I appreciate that. Well, I think it's important that we take whatever is life's given to us and turn it around for the better. Too many times we have something that happens like what happened to me, and we use as an excuse to not even try. I didn't want to just lay around and become a bum and just watch television all day. I want to help others, and I love the fact that you want to help others. And Okay, so you're hard of hearing, and I know sometimes that can be difficult, but you didn't let that hold you back. And for people like us that just don't let these things hold us back, I hope that's an inspiration to others to try.
Absolutely.
So now your book, is it on Amazon?
It is. It's on Amazon, Barnes and Noble, many other online retailers, independent booksellers as well.
Okay.
You can pick your poison.
All right. Well, I want to put the link up so people can just click on it and make it easy for them. Do you have a website?
Yes, it's also on my website, and I can tell you a little bit about it if you're interested. The book.
Yes, definitely.
Yeah. So the book is technically written for younger individuals. It's but for teenagers, tweens, and young adults. So really the 14 to kind of 24 range. But I really do think anyone can read it if they don't mind a few pop culture references. You know, a little bit of Taylor Swift, Bieber, Beyonce, if they can look past that. But it really is a book that's rooted in psychological science. And I do think that parents and caregivers and grandparents and teachers can pick it up for young people in their life. It's supposed to be giftable. Now, the colors of it and the format, if you look at it, it's pretty disarming. And there is a journaling component that is optional, where there's writing prompts that allow people, readers, to vent about their anxiety. But then after that, there's a section on some of the CBT methods that I was talking about earlier, including reframing, thinking traps, catastrophizing, mind reading, kind of how to deal with all of these thought traps that come up when we worry. And there's also a section in the book about themes that come up when we get anxious and worried. You know, for example, avoidance, uncertainty, discomfort, panic. And what I do is I have a paragraph about each of these things, as well as a paragraph about how to cope with it. So I think it's good for folks that don't necessarily have time to read. They just kind of want to dip in and get like a strategy right away. And the other piece of my book that I'm proud of is that I have something called coping statements. These are cheerleading statements, kind of like affirmations or mantras.
Mm-hmm.
You know, if you are freaking out and you're trying to calm down, it could be really helpful to kind of have just a statement like, this is rough, but I can handle it, or I've got this. So for each kind of worry topic, I have in the book examples of coping statements, and I think that's really helpful. So
Yeah.
I think the book has a lot to offer.
Do you talk about journaling?
Yes. The first part is writing prompts. You know, there would be a question, and then the person reading the book, if they want to, could either think about it or write about it. I'll give you an example. And the one that I'm looking at right now is about bullying. So the topic of the prompt is haters. And the question is, have you ever been bullied or seen someone be bullied? And then let me turn to another page and read you another prompt. Almost is never enough is the name of the prompt. The question is, do you try to achieve perfection in certain areas? Write about any really high standards you may have for yourself. So there's a lot of different topics that are covered in these prompts. In addition, there's something called a worry dump. So there's a few kind of designated worry dumps where you could just, anything that's on your mind, just get it out, get it on paper, get it out of your head. That could be really cathartic.
That could be difficult. So journaling and the affirmations. What about like vision boards?
I think having a visual cue is great. That's a great idea.
Mm-hmm.
I don't necessarily talk about that in my book, but we almost had a rating scale where you could kind of rate your worry from 0 to 10. I think that's a really good idea to have like a visual cue. but I do have diagrams in the book, kind of charts and a lot of visual, colorful images that I think folks would really appreciate.
You know, I had someone on the show that I brought up the fact of vision boards, and they told me to, instead of putting up stuff that I wanted to accomplish, to put in on there things that I've already accomplished, and how that gives you confidence. So I think that might be a good idea.
Yes, I mean, it's literally whatever works for you. And I think the most important thing is that the strategy is concrete and really clear. Like, do this thing. Because if you feel helpless or hopeless, and someone says, make a vision board, absolutely. And I think, like I said, it's good to have visual cues, especially if you're not like a reader or a writer. But I also say in my book, you don't have to be a good writer to do that. People are retweeting and texting and blogging and emailing. So we're all writers.
Yeah. I'll say all these methods, something's going to work for you. Not everything is going to work exactly for everyone. Sometimes we have to go through different types of methods to find what it is that can help us, because there's just not a cookie cutter solution for depression, anxiety, these things. Always look, don't give up, but find someone, a therapist you can talk to. And if medication is what you need, then go for it. You know, I say what worked for me may not work for you. I think you should at least read the book. You're going to find something in there that's going to help you. I guarantee you there's some kind of method in here that can help you with whatever your problem is. And Terri, you are wonderful. We didn't have any problems at all.
I mean, I certainly do. But I just want to reinforce everything you said just now and kind of emphasize that you can't really undersell the power of venting and talking to someone that is non-judgmental and who will hear you or who will support you. You know, research shows that putting words on your feelings, talking about them, quiet the area of the brain responsible for emotion regulation, which is the amygdala. So if you have a tough experience and you immediately talk about it after, you will process it so much better. And this is why therapy could help so many. And I don't think you even need to be in a crisis to go to therapy. I think anyone can benefit.
Oh yeah. Oh yeah. Just to build up your confidence. Yeah, there's all kinds of reasons to go. Don't sell yourself short. That's my main advice. You are valuable, and I know how you can convince yourself that you're not, because I've done it. I can't tell you how many times. I still have a problem with confidence, accepting people giving me compliments. Some reason I don't believe it myself at times, but don't sell yourself short. Just find someone to talk to. Get the help that you need. And Terri, so you got the website, you got your book. What about social media?
Yeah, so I am on Instagram, initially reluctantly, but now I have taken to it. My account is let me take it back. It's at Dr. TERRI BACOW, at Dr. TERRI BACOW. And Instagram is a lot of fun.
Yeah, sometimes it can be, if you use it the right way.
I think you have to really moderate your consumption. Like I find that I'll do it a little bit, then I'll take a step back, and then do it again. You have to not get saturated, otherwise you get overwhelmed.
That's right. Well, and to me, social media is a tool. I look at it like a hammer. If you use it the right way, you can build some beautiful things. But if you don't, you can hurt others or you can hurt yourself. So, Terri, this has been absolutely wonderful. I surely appreciate your time and coming on. I think this could be beneficial. So I'm stressing to all of you out there, if you are in need of some kind of help, even like you said, even if it's not a crisis, you just need some kind of help, find you some therapy. Read a book like hers. Something out there can help you. And
Thank you so much.
well, I'm
Thank
sorry.
you so much for having me. This
Oh,
was
yeah.
thank you.
Oh, of course. It was my pleasure, really. And I'm going to say this once again. I'm going to put all her links in the description, so it'll make it easy for you to click on and go to it. And Terry, again, thank you. And I hope you'll stay in touch. We'll have you back on again in the future.
I would love that. Best of luck to you in the meantime.
Thank you. Thank you. Thank you. I also want to thank all of you out there. If you are new to the channel, thank you so much for stopping by. I hope you subscribe and you'll come back. And for those of you out there who are regular to the channel, thank you for that support. I can't stress that enough. So until the next one, everyone, please take care. Be kind to one another. God bless and peace.
We hope you enjoyed this episode of Listen to the Vibes. You can catch us on Buzzsprout or wherever you listen to your favorite podcasts, and on YouTube. Follow us on Facebook at The Vibes Broadcast Network